I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're talking about today are signs and symptoms that your body is sending you, messages your body is sending you to tell you that there's something wrong. And I got so many of these that we've compiled that I may have to do several shows on it, actually. But these are all fun tidbits that you can look for to say, wow, that's telling me that there's something not right. So if you have chronic heartburn, the most common situation that causes this, well, the only situation I know of causes it, is your stomach, which is supposed to sit below your diaphragm, is actually pushed up through your diaphragm. And when the stomach pushes up through the diaphragm, you get something called acid reflux or heartburn. Now, over time, what happens is the acid can start to irritate the lower part of your esophagus, and it can actually cause scar tissue to form. And it could even turn cancerous. And that's called Barrett's esophagus. I don't know who Barrett is, but whoever Barrett he or she is figured out that when acid gets into that area, it can cause this scarring to occur, and it's called Barrett's esophagus. Now, there is therapy where they can go in there medically, we can't do it at our office, and stretch out and try to break up some of that scar tissue. That's all well and good, but it doesn't treat the cause. The cause is the stomach pushing up through the diaphragm. So you might want to come see us if you have acid reflux, because the number one reason that we see patients is pain. Back pain, headaches, neck pain, shoulder pain, sciatica, car accident injuries, sports injuries. Number one reason we see patients is because of pain. The number two reason we see patients is because of digestive issues. Heartburn, acid reflux, burping, gas, bloating, GERD, gastroesophageal reflux disease. So we're really good at working on that. And the reason I say that is I have acid reflux periodically. So I've trained all my doctors to work on the esophagus, to actually take the stomach and pull it down away from the diaphragm. And it's a very simple, painless adjustment. And we do it all day, every day, I think is safe to say in our offices. Very, very effective in most cases. Nothing's 100% effective, of course, but we get pretty good results across the board of fixing that. So if you have acid reflux, that's a warning sign. Now, the traditional treatment that's used is we give you medication to neutralize your stomach acid. Well, here's the problem with that. You need stomach acid. You need stomach acid to digest proteins, break down proteins into amino acids. So if you neutralize your stomach acid, now you can't break down your proteins into amino acids, and so your body is lacking in proteins and amino acids. So that becomes a big serious issue and a catch-22. Now, if you ever read the directions on the pills that you're taking for stomach or digestive issues, acid reflux, they clearly say don't take for more than, I think, 4 weeks, 6 weeks. If you take it more than 4 to 6 weeks, you're not able to digest your food properly. And also, one of the key primary defense mechanisms in your body is your stomach acid. You're always sucking down viruses, germs, bacteria, pathogens, and so the stomach acid kills a lot of these things. So if you're neutralizing your stomach acid, you run the risk of not being able to have the strong immune system that you should have. So why would you want to do that, especially if there's a way to fix it? If there's no other way to fix it, folks, I get it. You know, if I get a headache, I'll take some acetaminophen. Then I'll go get a chiropractic adjustment to figure out why I had the headache. But if I'm in pain, I want to get that under control right away. But if you have a way to fix a problem and you don't do it, and you keep doing medication, which then gives you side effects and long-term damage, well, that's your fault. A famous man once said, "Forgive them, for they know not what they do." And we've all done things because we didn't understand what we were doing. But with this show and the thousands of hours of other shows I've given you, we've given you so many answers on how to fix things that there really isn't an excuse anymore. We've given you the secrets to get well and stay well in most cases. So if you're not doing it, that's your fault. The shows are on the website, drjoe.com. They're absolutely free. There's over 2,000 hours of podcasts, audio and video. If you're a podcast junkie, you can go to Dr. Joe, your podcast service, and type in Dr. Joe for the health of it. And Dr. Joe for the health of it is going to bring you to all our podcasts that we have on our podcast services. So we have tons of information for free available to you. And if you have a health question, send it to us through the website, drjoe.com, and we'll answer it for you. I can't make this any easier for you, folks. So if you're suffering, I'm going to have to put the blame back on you. Because many times we have the answers. Not everything. But many times we have the answers, and if you're not following up with it, well, that's your fault. And if you do want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. We would love the opportunity to work with you to try to get the nervous system working properly, the digestive system working properly, and put together a good nutritional plan specifically for you. So I don't know what else to do unless I'm going to come to your house, which I'm not going to do. But if you want to make an appointment, drjoe.com. We accept most insurances. Probably half our patients don't have any insurance. It's extremely affordable to be a patient with us. There's no reason why you shouldn't be making an appointment right now at drjoe.com. You can book it right online or you can call us. Other things, other symptoms that you may have that are telling you something more serious is going on. You crave salty foods. You could have something called Addison's disease. Some people love salty food. But if you find you're suddenly craving anything with salt and you're adding extra salt to your food, it could be a sign of something more serious. The adrenal glands, which are little glands that sit on top of your kidneys, that's some of my favorite glands in the body. If there's a deficiency in your adrenal glands, it could be called something called Addison's disease. And it can lead to intense cravings for salt. Now, again, yeah, you like salty foods, I get that, but intense cravings for salt is what we're talking about here. If it's accompanied by muscle fatigue, abdominal pain, and craving for salt, you might want to get your adrenal glands checked because it could be a sign your adrenal glands are pooping out. And if your adrenal glands are pooping out, you say to yourself, what do I do about it? Well, there's a supplement I take every day called Dr. Joe's Adrenal Support. Now, the adrenal glands produce adrenaline, they give you energy. They produce anti-inflammatories called prostaglandins, and they produce something called pregnenolone, which becomes your sex hormones. So your adrenal glands are really important. And I take adrenal support every single day as a prophylactic measure. I want to make sure I'm taking care of myself because as I'm getting older, I want to do everything I can to fight the aging process, and I'm doing a darn good job with it. Most people think I'm about 15 or 20 years younger than I am, and I'm perfectly fine with that. And a lot of it has to do with, well, I think all of it has to do with making sure my nervous system is working through chiropractic care, making sure I'm getting a good diet, I eat a good diet, and I take really high-quality supplements, Dr. Joe's supplements. And so there's no reason why you can't be doing that too. I don't have any secret that I'm keeping from you. Normally functioning nervous system, normally functioning digestive system, good nutrition. There's my secret. And everything I do personally is available to you and your family and friends. So go to the website, drjoe.com, make an appointment. If you have trouble hearing, this could be a sign of kidney problems. Now, if you're having trouble hearing what others are saying, it might not just be your ears that need to be checked. There's a 2010 study published in the American Journal of Kidney Disease. Older adults with chronic kidney disease are more likely to have hearing loss than those without. Hearing loss is commonly linked to kidney disease. However, this study suggests a strong tie between kidney disease and hearing loss. So, if you're having hearing issues, it wouldn't hurt to get those kidneys checked as well. Why not? And that's what I tell people. When it comes to diagnostic tests, blood work, MRIs, things like this, I have no problem getting you tested. I had a message come to me this morning. One of our patients, her boyfriend is a patient here. She's a patient here too. And he's having a little radiating pain in the middle of his back. Now, he's only come in for like 4 or 5 visits, so I think we're way too early to jump to conclusions. But I said, let's send him out for an MRI. Let's see what's going on. Most of the time, the tests come back negative. So now we know what it's not. And I love to know what it's not, because then we can focus on what it is. And every day patients come in our offices. Dr. Joe, I've done this test, this test, this test. and the doctors say, I don't know what it is. I'm stuck. I had a lady the other day with swelling in her ankle and cold feet. And she's had ultrasounds, and she's had vascular tests, and she had nerve conduction velocity tests, and everything came back negative. I said, great. Now we know what it's not. Most likely, it's a pinched nerve in your low back. It's not tumors. It's not cancer. It's not a blood supply issue. It's probably just a pinched nerve in her low back. And she says, I have been having back pain. In fact, the pain started right around when my leg started. So she was very happy with the results there because we told her what the problem was. So we always try to get to the cause of the problem and not just treat the symptoms. And that's what's unique about our office is and again, if you need to treat the symptoms, that's great, but we always want to get to the cause of the problem. So I have no problem doing some more diagnostic tests if necessary. So if you do have hard of hearing issues, wouldn't hurt to get your kidneys checked. And if it comes back negative, great, came back negative. Other symptoms that you may not understand what they mean. Your breath smells sweet. You could have diabetes. And this is something I teach cops a lot, is they'll pull somebody over and the cop leans in the window and they can smell the person's breath and they say, this person's been drinking, I can smell it. Maybe not. It might be that they're diabetic. If your body doesn't produce enough insulin or isn't working properly, which is what happens in diabetes, your body produces something called ketones. And ketones can actually start to build up in your blood. And your body's going to try to get rid of them through your saliva, causing your breath to smell sweet, and sometimes actually like nail polish remover. So this is such a reliable sign that in 2014, published in the Journal of Breath Research, found that a breath scent is dependable, non-invasive way to tell if young children have type 1 diabetes. So if you have a child and their breath smells sweet, or acetone is another way they'll word it, you definitely want to check for diabetes. I remember I had a patient years and years and years ago when I first started in practice, an older couple, very, very old. And they drove all the way from Rome, Georgia to Marietta, Georgia because they wanted to see Dr. Joe. And they were much older. And I remember adjusting her one day and her breath smelled like she was just boozing it. She just smelled like booze, and I thought, this lady's drunk. And I thought, she doesn't seem like the drinking type. Good, hardcore Christian folks. And I thought, So I had to remember back when I was in college what that meant. And I said, have you ever been checked for diabetes? And she said, no, I never have. I said, let's get a blood work done for you and let's see what it was. And sure enough, she was in advanced stage type 2 diabetes. And she had no idea. But the smell on her breath led me to get the diagnostic test, which then, of course, hopefully saved her life. So, yes, sweet smell doesn't always mean that somebody's drunk. It could mean that they have diabetes. And especially with children, keep an eye on that. It's a good way to diagnose type 1 diabetes. So, if you have a lump on your collarbone, this could be an early sign of gastric or digestive cancer. Right above your collarbone, near your neck, there's a lymph node called Virchow's node. And oddly enough, this can be a warning sign for your digestive system. When this node swells up, a condition called supraclavicular lymphadenopathy, it may be the first sign of cancer of the stomach, the intestines, or the colon. Once again, we don't understand exactly why some of these signs are there, but we do know if this sign is there, it correlates with something else. So if you feel a lump on top of your collarbone, once again, just telling you might want to go get it checked. Now, people ask me a lot, say, Dr. Joe, my hair is thinning. What could it be? Well, it could be that you're getting older. It could be that you're male pattern baldness. It's one of the curses we men have to deal with. But it could be you have an iron deficiency. 2013 study in the Journal of Korean Medical Science, lack of iron, which helps your blood move oxygen through your brain and your muscles, might actually cause your hair to fall out. So once again, could be just male pattern baldness, could be that you're getting older. Check your iron levels. You also want to check your thyroid levels because hair loss could be due to thyroid issues. So if you want to get that checked, get your blood work done, check your iron, and then also check your thyroid as well. And if those are the cases, wouldn't hurt to get that fixed. So once again, these are warning signs your body is sending you out, telling you that there's something wrong. Here's an interesting one. You laugh or you cry uncontrollably for no reason. It could be a sign that you have multiple sclerosis. It's called pseudobulbar effect, And it's more or less, it's distressing and embarrassing. It's more distressing and embarrassing than just laughing at a bad joke. It occurs in 10% of people with multiple sclerosis, although some research suggests a much larger percentage. Now, this can also happen with traumatic brain injury. Again, I'm certified in treating traumatic brain injury patients. And somebody can be in a car accident, which is the common ones that I see in my offices. And suddenly the person just bursts out, uncontrollable crying, uncontrollable laughter. It doesn't make sense. And you're looking at that person going, my God, they're crazy. Not necessarily. The pseudobulbar effect is telling us that there's been damage to the brain and the brain is responding in an unnatural way. So, uncontrollable laughter, crying, outbursts like that could be a sign of an organic or a specific brain injury or brain problem, not necessarily the person is just weird. So once again, look for these things and say, something's wrong. This is a warning sign. I don't want to ignore that. And I look at that with every patient that comes in our office. Number one reason we see patients is pain. Neck pain, back pain, shoulder pain, numbness, tingling. Number two reason is digestive issues. Every patient that comes in, I look at the patient as a warning sign. What is this pain telling me? The pain is not the problem. The cause of the pain is the problem. So if I have neck pain, it's not the pain that's a problem. What's causing my neck pain? Is it a ruptured disc? Is it a pinched nerve? Is it a bone out of place, pinching a nerve? Is it inflammation of the facet joints? Is it muscle spasms? So we always have to diagnose and try to get to the cause of the problem and not just treat the symptoms. We can easily get a patient to a medical doctor and get them medications, but that's not going to fix anything. It's going to cover up the symptoms, but it's not going to treat the cause. And I'm not against medication, believe me, but we try to always treat the cause as well as cover up the symptoms if we need to. If we treat the cause, we don't have to cover up the symptoms. And that's the cool part. We get to the cause of your problem. If you have puffy eyes, could be a sign of heart or kidney disease. Now, bags under the eyes I always think of as adrenal. And the adrenal glands are not technically the kidneys, but they sit right on top of the kidneys. So when I see puffy eyes, I always start to think, first thing is an adrenal insufficiency. Are you tired all the time? You have puffy eyes, sex hormone issues, inflammatory issues. We want to get them treated for those adrenal issues. But kidney and heart problems can prevent your body from getting rid of excess fluid, and it can start to build up in unusual places, particularly in the mornings, particularly around the eyes. Although many other things can cause puffiness around the eyes, including lack of sleep, it could be a sign of something more serious, according to the National Kidney Foundation. So most times when I see puffiness under the eyes, I get them on Super Greens and Essential Source, which are the minimum supplements everybody should be taking. I'll get them on adrenal support, nitric oxide to increase circulation, and let's give it a few months and let's see what happens. And in most cases, it really, people start to look so much younger when they're taking supplements, good quality supplements. My German grandfather always said, always buy the best, it's always cheaper. And that's so true with supplements. Now, you don't have to pay too much for things. There are some things that aren't the best that are very expensive, but the best is what I'm looking for, especially when it comes to healthcare. I wouldn't want discount brain surgery. I wouldn't want to discount a doctor removing my appendix. I wouldn't want discount supplements, and I wouldn't want discount chiropractic care either, because you get what you pay for. And there's usually a reason why these doctors are working where they are, even some of these big medical clinics. There's certain ones out there, insurance companies, but you have to go to their own hospitals. Many times these doctors, they just couldn't get other jobs. And they go there, it's an easy job, they get paid X amount of dollars, and they just have to see patients. You know, they're not going to try to get repeat business because they're not benefiting directly from the patient getting well. And that worries me. I like a little competition in life. I want to make sure that I'm getting, somebody wants my business and somebody's going to do a good job for me, not they're getting paid whether I show up or not. And so, just so you understand, I wouldn't take discount when it comes to healthcare because I don't want discount healthcare. I want top quality healthcare, the best there is. If your ears hurt after a big meal, this can be a sign of acid reflux. I found this out years ago. I had a patient named Holly, and whenever I adjusted her stomach, her ears would ring because she had acid reflux. Referred pain occurs when an injury or trauma to one part of the body causes another part of the body to hurt. So in this case, the esophagus and the ears are both located along what's something called the vagus nerve, my favorite nerve in the body. So stomach acid can irritate the esophagus, which can cause pain along the vagus nerve, which can show up elsewhere, including in the ears. According to an article in the American Family Physician, you can have gastroesophageal reflux disease without ever feeling heartburn. And one possible symptom of gastroesophageal reflux disease is ear pain. So kind of interesting how everything ties together. And I hear this all the time. Patients say to me, Dr. Joe, the way you explain things is that everything is connected. Yes, everything is connected. There's a company, one of the radio stations I work with, and they sell foot inserts. And the sales rep came to me and they said, would you be willing to endorse this company? And I said, yeah, it's a good company. I like them. I'd be willing to do an endorsement for them. And she said, well, what would you say about them? And I said, I'm going to write you a commercial right now on the spot. And I said, hey, folks, Dr. Joe here. Did you know that 1/4 of all the bones in your body are in your feet? And if any one of those bones come out of place, that can cause the knee to shift and the hip to shift and the low back to shift. And everything in your spine can shift because one of the bones in your foot is out of place. It could even cause headaches. She lost her mind, the sales rep. She said, that was the best commercial I've ever heard, especially for a product like this. I said, that's because you got to know your product and you got to know what you're talking about. And when you have marketing companies writing commercials for something they know nothing about, that worries me. I want somebody who knows the product inside and out writing the commercials. And so same thing when it comes to the body. Everything is connected. And when you understand how everything interacts with everything else, it's a lot easier to get to the cause of the healthcare problem and not just treat the symptoms. And that's what we do in our offices. Sometimes we have to adjust somebody's feet or their knees or their hips or their psoas muscle or their ileocecal valve or their stomach to get to the cause of the problem. Now, we can't promise results for everyone. So don't think if you're going to come in, we're going to guarantee it's going to be fixed. No. But a major majority of our patients are extremely happy with the results that they get as patients with us. Because we work on three things. We work on the nervous system, making sure we get the nervous system working, unpinching as many nerves as we can. We work on the digestive system. If the stomach is pushed up against the diaphragm, like we just said, it could cause your ears to hurt. We can actually take the stomach, physically adjust it or pull it down away from the diaphragm. When we pull the stomach down away from the diaphragm, we physically put the stomach back in the position it needs to be in. Pretty exciting. And then we work on the diet. And the diet is easy because you have to eat anyway. You might as well eat good foods. And we put together a dietary plan for every one of our patients, what to eat, what not to eat. And then we recommend supplements specifically for them. But the minimum supplements I think everybody should be taking, starter kit, will be Dr. Joe's Super Greens and Dr. Joe's Essential Source. If you don't get outside a lot in the sun, which is about 20 minutes a day, I'd recommend vitamin D. If you're older than 30, I'd recommend taking a digestive enzyme supplement with every cooked meal you eat. Because cooked foods, when you cook a food, you destroy the enzymes. And the enzymes are the secret missing link to healthcare. So I would recommend the digestive enzymes. B-complex, just as a prophylactic. Most people are deficient in B vitamins. It gives you energy, helps the brain work more efficiently. Probiotics, keep the immune system strong. If you're taking medications, if you're getting older, I recommend glutathione. Glutathione helps the liver heal. So you could look at glutathione. And again, these are some of the supplements I take. Omega-3 fatty acids for brain function. Every day people ask me, Dr. Joe, how do you do what you do? You've never been stumped, it seems, when it comes to healthcare questions. You get them on the fly. I get stopped all day, every day. Patients stop me in a grocery store. And they say, how do you know all these answers? I said, I take care of my brain. And so if you want to make an appointment, we'd love to have you as a patient. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Stop suffering needlessly. Take that next step. We take most insurances as well, and cash patients and car accidents. drjoe.com. Book your appointment right now. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.